Good morning. Today, your patient safety team will be presenting the CSIP Leading a Culture of Safety Curriculum 3. Today, our goal is to share how we, as leaders of our organization, can create and foster a top-performing safety culture, which is foundational to eliminating patient harm. Healthcare organizations must develop a culture of safety such that the organization's care processes and staff are focused on improving patient safety and eliminating harm. How do we, as leaders, champion this culture? Leadership's role in speaking up. The key to patient safety is empowering the voice of the frontline providers. It is the first crucial step on our path to success. This allows us to become a learning organization focused on safety and improvement. Positive recognition of staff when they speak up to report events, concerns, or suggestions for improvement. Clear communication of facility vision and expectations to individuals is necessary. And systemic accountability within a culture, frontline staff accountability to report, leadership accountability to review and improve reported events, and accountability of board and executive leaders for overall process. Healthcare providers have historically entered the field due to a strong desire to make lives better. That motivation now is fundamentally tied to ensuring that while making the lives of our patients better, we also are committed to ensuring our system is safe and predictable for each patient. Patient safety is the foundation of a positive patient experience. Reporting should never be penalized. Additionally, staff should have closed-loop communication with leadership to know that actions and follow-ups are initiated from the event reporting. Event reporting promotes risk identification of risks and events that have caused harm or has the potential to cause harm. Real-time communication of identified near miss and safety events in a standardized, reliable approach. It also promotes a learning system, trending capabilities, which lead to process improvement and continued learning opportunities. Choreographed educational offerings based on actual trended event types and causations. And storytelling and shared learning opportunities within a unit, hospital, division, and at the enterprise level. Event reporting also promotes staff engagement, encourages empowerment of staff to speak up in a safe and reliable system. Voices are heard. Encourages staff ownership and recognition and celebration of reporting adverse events, safety events, and near-miss good catch events. In addition to the affirmative duty of all healthcare providers to report events and close calls, there are many additional reasons that healthcare providers should report all identified risks. Healthcare leadership is unable to effectively assess systems without accurate reporting of events and vulnerabilities. Risk identification is the foundation of a safety culture. Keep in mind, accreditation and regulatory bodies, both state and federal, require healthcare providers to report safety events and utilize information to improve safety systems. However, this should not be the primary driver of event reporting.
There are three categories of safety events. First, safety risk event. Events that reach the patient whether or not there was harm involved. Some examples: patient receives the wrong medication, patient develops complications following a procedure, or physician order for telemetry is not placed for 8 hours into patient's admission. Secondly, unsafe conditions. Circumstances that increase the probability of a patient's safety event occurring. For example, new floor wax in the rehab center is very slippery and hard to walk on, or code peak alarms are not working currently. And third, near miss good catch. Patient safety events that did not reach the patient. For example, physician orders the wrong dose of morphine. Pharmacist catches the error, clarifies with the physician, and corrects the order in the record. Patient did not receive incorrect dose. Or FNS delivered a food tray to nurse's station. Nurse recognized patient was NPO, and the nurse informed FNS. Patient did not receive the tray. Risk identification to risk mitigation process. Risk identification is the foundation of a safety culture. Educating staff and leaders on how and what to identify is the foundation to improvement. Risk notification should follow risk identification to allow leaders and others to review causations of the identified risks. Risk mitigation strategizes to follow the identification of the recognized causations. A thorough review of an actual event, and especially near misses, provides an opportunity to identify vulnerabilities or future risks to patients' employees. Event investigations include staff interviews, communication with other involved units, departments, etc. A solo chart review is usually not a sufficient methodology. Identified risk could involve systemic risk, such as process failures, lack of process sustainability, or inherent lack of standardized practice. Additional risk could exist within environment of care, human factors, breakdown of culture, and/or normalized deviance. Thorough event investigations resulting in accurate identification of causation lead to strong actions to prevent recurrence and to reduce risk to patients and the workforce.
Consider the substitution test when reviewing events to assist with the determination of a system failure or vulnerability versus individual decision-making. The substitution test is part of the Accountability Unsafe Act algorithm that will be discussed in Management Council's session, Coaching for Excellence. James Reason Substitution Test. Would 3 other individuals with similar experiences in a similar situation and environment act in the same manner as a person being evaluated? If the answer is yes, the problem is not the individual, but more likely the environment that would lead more individuals to that action. If the answer is no, if similarly experienced individuals would not have acted in a similar manner, it is more likely that the individual being evaluated is more culpable, accountable, and in need of action. That might include coaching, counseling, removal, or corrective action. In conclusion, we would like to share practices that foster a culture of safety. Our facility has monthly recognition of near misses with the Good Catch Awards. There's collaboration between patient safety and senior nursing leaders to ensure a thorough review of events and follow up with staff. We've had 271 near misses reported in quarter 1 and quarter 2 of 2020. During our facility-wide morning huddle, leadership shares great catches, near misses, serious safety events, and lessons learned. Executive leaders do leadership rounds in on all units. Thank you for your time and for all you do for patient safety.